Melissa, a 32-year-old graphic designer, received a phone call about dental bills that would test her understanding of dental billing and teach her valuable lessons about phantom dental debt scams. The caller claimed she owed thousands of dollars for root canal treatment she had never received at a dental office she had never visited. Melissa maintained excellent dental hygiene through regular cleanings and checkups with her longtime family dentist, Dr. Williams, and had never experienced tooth pain or dental problems that would require root canal treatment. Her dental insurance covered her preventive care without any billing complications or outstanding balances. Melissa had not received any major dental treatments or procedures that would account for substantial dental bills or collection efforts from dental practices or billing companies she didn't recognize. The caller, who identified herself as dental billing specialist Karen Thompson from Advanced Dental Collections, claimed that Melissa owed $3,400 for root canal therapy and crown placement that had been performed 8 months earlier at Premier Dental Associates. Ms. Rodriguez, you have an outstanding dental bill of $3,400 for root canal treatment on tooth number 14 and porcelain crown restoration completed at Premier Dental Associates on January 20th, Thompson said with apparent dental billing knowledge and specific procedure expertise. Thompson claimed that Melissa's dental insurance had denied coverage for the root canal treatment due to missing pre-authorization and that the dental practice had referred her account to their collection agency for immediate payment. Ms. Rodriguez, dental insurance requires prior authorization for major procedures like root canals, and when authorization is missing, patients become responsible for the full cost of dental services. Thompson continued with apparent insurance authorization knowledge and dental billing expertise. Thompson explained that immediate payment was necessary to prevent the dental debt from being reported to credit bureaus and that additional collection fees would be added if the account was not resolved within 72 hours. Melissa was confused because she had never been to Premier Dental Associates or experienced tooth pain that would require root canal treatment, and she would definitely remember having such significant dental work performed. "I've never been to Premier Dental Associates or had a root canal," Melissa explained to Thompson. "Can you provide documentation showing the treatment records and the insurance pre-authorization denial?" Thompson became evasive when Melissa requested dental records, claiming that detailed treatment information couldn't be discussed over the phone due to patient privacy regulations, but insisting that the debt was legitimate and required immediate payment. Ms. Rodriguez, dental treatment records contain sensitive medical information that requires patient authorization before they can be discussed, but I can confirm this debt is valid. Thompson explained with apparent privacy regulation knowledge and authorization procedures. Thompson also claimed that the dental debt collection process was accelerated and that Melissa would face legal action if payment was not received within the specified time frame. Melissa felt suspicious about Thompson's privacy claims and decided to verify the dental debt independently through her regular dentist and insurance company. Melissa contacted Premier Dental Associates directly to verify whether she had received any treatment and learned that she had no patient records or treatment history in their system. Melissa also contacted her dental insurance company to review her claims history and confirmed that no root canal or crown procedures had been submitted or processed for her coverage. Melissa verified with her regular dentist, Dr. Williams, that her teeth were healthy and that no referrals had been made for root canal treatment at any other dental practices. Melissa realized that Advanced Dental Collections was fraudulently claiming dental debt for procedures she had never received and using legitimate dental terminology to create believable billing scenarios. Melissa contacted Advanced Dental Collections to inform Thompson that the fraudulent claims had been verified, but Thompson continued to insist that the dental debt was legitimate and pressured her for immediate payment. Melissa reported the dental billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General Office, and Premier Dental Associates Administrative Office. The authorities explained that legitimate dental billing involves proper treatment documentation, insurance processing, and coordination with dental practices before pursuing collection activities against patients. Melissa learned that patients should verify all dental debt claims through their regular dentists and insurance companies and should request detailed treatment records for any procedures they don't remember receiving. The experience taught Melissa to maintain detailed records of her dental care, and to verify all dental debt claims through direct contact with her regular dental provider and insurance company. Melissa now educates others about dental billing fraud and emphasizes the importance of verifying dental debt claims through legitimate dental practices and insurance channels before making payments to collection agencies. Brandon, a 28-year-old warehouse supervisor, received threatening calls about dental collection that would test his knowledge of orthodontic billing and teach him valuable lessons about fake dental treatment scams. The caller claimed he owed money for braces and orthodontic treatment he had never received. Brandon had straight teeth and had never required orthodontic treatment or braces during his childhood or adult years. His dental insurance through his warehouse job covered his routine cleanings and checkups without any billing issues or collection problems. Brandon had not received any orthodontic treatment or dental appliances that would account for substantial dental bills or collection efforts from orthodontic practices or dental billing companies. The caller, who identified himself as orthodontic billing agent Michael Davis from Specialty Dental Recovery, claimed that Brandon owed $4,800 for orthodontic treatment and retainer appliances provided over an 18-month period at Smile Orthodontic Center. Mr. Johnson, you have an outstanding orthodontic bill of $4,800 for comprehensive braces treatment and retainer fabrication completed at Smile Orthodontic Center over your treatment period, Davis said with apparent orthodontic billing knowledge and treatment timeline expertise. Davis claimed that Brandon's dental insurance had denied coverage for the orthodontic treatment due to age restrictions and that the orthodontic practice had referred his account to their collection agency after multiple billing attempts. Mr. Johnson, adult orthodontic treatment often isn't covered by dental insurance due to age limitations, leaving patients responsible for the full cost of braces and related services. Davis continued with apparent insurance limitation knowledge and orthodontic billing expertise. Davis explained that immediate payment was necessary to prevent the orthodontic debt from affecting Brandon's credit score, and that legal action would be pursued if the account was not resolved within 1 week. Brandon was confused because he had never worn braces or received orthodontic treatment, and his teeth had always been straight without requiring any dental correction. I've never had braces or been to Smile Orthodontic Center, Brandon explained to Davis. Can you provide treatment records showing when this orthodontic work was supposedly done? Davis became aggressive when Brandon questioned the orthodontic debt, claiming that adult orthodontic patients sometimes forget about treatment completion and that questioning legitimate dental bills would result in additional collection fees. Mr. Johnson, adult patients sometimes don't remember the details of their orthodontic treatment after braces are removed, but that doesn't eliminate their financial responsibility. Davis insisted with apparent orthodontic treatment knowledge and patient memory issues. Davis also threatened to contact Brandon's employer about the unpaid orthodontic debt, claiming that unresolved dental bills could affect his employment background checks and professional reputation. Brandon felt frustrated by Davis's aggressive tactics and decided to verify the orthodontic debt through his dental insurance and local orthodontic practices. Brandon contacted Smile Orthodontic Center to verify whether he had received any treatment and learned that they had no patient records or treatment information for him in their system. Brandon also contacted his dental insurance company to review his claims history and confirmed that no orthodontic treatment claims had been submitted or processed for his coverage. Brandon verified with his regular dentist that his teeth were naturally straight and that no orthodontic referrals had ever been made for his care. Brandon realized that Specialty Dental Recovery was fraudulently claiming orthodontic debt for treatment he had never received and attempting to exploit his knowledge of adult orthodontic treatment to create believable billing scenarios. Brandon contacted Specialty Dental Recovery to inform Davis that the fraudulent claims had been verified, but Davis continued to insist that the orthodontic debt was legitimate and threatened immediate legal action. Brandon reported the orthodontic billing fraud to his dental insurance company's fraud department, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate orthodontic billing involves extensive treatment documentation, progress records, and proper insurance processing before pursuing collection activities against patients. Brandon learned that patients should verify all orthodontic debt claims through their dental insurance companies and should be suspicious of collection agencies claiming treatment that cannot be documented through legitimate orthodontic practices. The experience taught Brandon to recognize fraudulent dental billing and to help educate other warehouse workers about verifying dental debt through legitimate dental providers and insurance channels. Brandon now educates other workers about dental billing fraud and emphasizes verifying all orthodontic debt claims through dental insurance companies and legitimate dental practices before making payments to collection agencies. Jennifer, a 34-year-old elementary teacher, received calls about dental surgery bills that would test her understanding of oral surgery billing and teach her valuable lessons about phantom dental surgery scams. The caller claimed she owed money for wisdom tooth extraction she had never undergone. Jennifer had all 4 wisdom teeth and had never experienced problems with them that would require surgical extraction. Her dental insurance through the school district covered her routine dental care, and her regular dentist had never recommended wisdom tooth removal. Jennifer had not undergone any oral surgery procedures that would account for surgical bills or collection efforts from oral surgery practices or dental billing companies. The caller, who identified herself as Oral Surgery Billing Coordinator Lisa Wilson from Surgical Dental Collections, claimed that Jennifer owed $2,900 for wisdom tooth extraction and surgical follow-up care provided 6 months earlier at Advanced Oral Surgery Center. Ms. Martinez, you have an outstanding oral surgery bill of $2,900 for impacted wisdom tooth extraction and postoperative care provided at Advanced Oral Surgery Center on March 15th, Wilson said with apparent oral surgery knowledge and surgical procedure expertise. Wilson claimed that Jennifer's dental insurance had denied coverage for the wisdom tooth extraction due to medical necessity requirements, and that the oral surgery practice had referred her account to their collection agency. Ms. Martinez, wisdom tooth extraction requires documentation of medical necessity for insurance coverage, and when necessity criteria aren't met, patients become responsible for the full surgical costs. Wilson continued with apparent insurance necessity knowledge and oral surgery billing expertise. Wilson explained that immediate payment was necessary to prevent the surgical debt from being reported to credit bureaus and that additional collection fees would be added if the account was not resolved within 48 hours. Jennifer was confused because she still had all 4 wisdom teeth and had never undergone oral surgery or been referred to Advanced Oral Surgery Center for any procedures. I still have all my wisdom teeth and have never had oral surgery, Jennifer explained to Wilson. Can you provide surgical records and documentation of the medical necessity denial? Wilson became evasive when Jennifer requested surgical documentation, claiming that operative reports and billing information contained sensitive medical information that required patient authorization before release. Ms. Martinez, oral surgery records contain detailed medical information that requires patient authorization and payment verification before they can be discussed, Wilson explained with apparent medical privacy knowledge and authorization procedures. Wilson also claimed that the surgical debt was approaching legal collection deadlines and that Jennifer would face additional attorney fees if she didn't authorize payment immediately. Jennifer felt suspicious about Wilson's privacy claims and decided to verify the oral surgery billing independently through her dental providers and insurance company. Jennifer contacted Advanced Oral Surgery Center to verify whether she had received any procedures and learned that she had no patient records or surgical appointments in their system. Jennifer also contacted her regular dentist to confirm that all 4 wisdom teeth were still present and that no surgical referrals had been made for her care. Jennifer contacted her dental insurance company to review her claims history and confirmed that no oral surgery procedures had been submitted or processed for her coverage. Jennifer realized that Surgical Dental Collections was fraudulently claiming oral surgery debt for procedures she had never received and using legitimate surgical terminology to create believable billing scenarios. Jennifer contacted Surgical Dental Collections to inform Wilson that the fraudulent claims had been verified, but Wilson continued to insist that the surgical debt was legitimate and pressured her for immediate payment. Jennifer reported the oral surgery billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General Office, and Advanced Oral Surgery Center's Compliance Department. The authorities explained that legitimate oral surgery billing involves proper surgical documentation, medical necessity verification, and insurance processing before pursuing collection activities against patients. Jennifer learned that patients should verify all oral surgery debt claims through their regular dentists and insurance companies and should request detailed surgical records for any procedures they don't remember undergoing. The experience taught Jennifer to maintain awareness of her dental health status and to verify all dental debt claims through direct contact with her regular dental providers and insurance company. Jennifer now educates other teachers about dental billing fraud and emphasizes the importance of verifying oral surgery debt claims through legitimate dental practices and insurance channels. Christopher, a 29-year-old construction worker, received phone calls about periodontal bills that would test his understanding of gum disease treatment billing and teach her valuable lessons about fake dental therapy scams. The caller claimed he owed money for extensive gum treatment he had never received. Christopher maintained good oral hygiene and had healthy gums according to his regular dental checkups. His dental insurance through the construction union covered his preventive care, and his dentist had never indicated that he needed gum disease treatment or periodontal therapy. Christopher had not received any periodontal treatment or gum therapy procedures that would account for substantial dental bills or collection efforts from periodontal specialists or dental billing companies. The caller, who identified himself as periodontal billing agent Stephen Clark from Gum Disease Recovery Services, claimed that Christopher owed $3,600 for scaling and root planing treatment and periodontal maintenance provided over 4 appointments at Metropolitan Periodontics. Mr. Wilson, you have an outstanding periodontal bill of $3,600 for deep cleaning procedures and gum disease treatment completed at Metropolitan Periodontics during your therapy phase, Clark said with apparent periodontal billing knowledge and treatment procedure expertise. Clark claimed that Christopher's dental insurance had denied coverage for the periodontal treatment due to frequency limitations and that the periodontal practice had referred his account to their collection agency for immediate payment. Mr. Wilson, periodontal treatment has insurance frequency restrictions, and when patients exceed coverage limits, they become responsible for additional treatment costs. Clark continued with apparent insurance limitation knowledge and periodontal billing expertise. Clark explained that immediate payment was necessary to prevent the periodontal debt from affecting Christopher's credit score and that his gum health records would indicate continued treatment needs if the account wasn't resolved. Christopher was confused because his gums were healthy and he had never been referred to Metropolitan Periodontics or received any gum disease treatment beyond routine cleanings. My gums are healthy and I've never needed gum disease treatment, Christopher explained to Clark. Can you provide treatment records showing what periodontal procedures were supposedly performed? Clark became insistent when Christopher questioned the periodontal debt, claiming that gum disease often progresses without obvious symptoms and that patients sometimes don't remember extensive cleaning appointments. Mr. Wilson, periodontal disease can be present without noticeable symptoms, and patients often don't realize the extent of treatment they've received for gum problems, Clark explained with apparent gum disease knowledge and patient awareness issues. Clark also claimed that construction workers were particularly susceptible to gum disease due to work environment factors and that Christopher's occupation made the periodontal treatment medically necessary. Christopher felt suspicious about Clark's occupational health claims and decided to verify the periodontal billing through his union dental benefits and regular dental provider. Christopher contacted Metropolitan Periodontics to verify whether he had received any treatment and learned that they had no patient records or appointment history for him in their system. Christopher also contacted his regular dentist to confirm that his gums were healthy and that no periodontal referrals had been made for his care. Christopher contacted his union dental insurance to review his claims history and confirmed that no periodontal treatment claims had been submitted or processed for his coverage. Christopher realized that Gum Disease Recovery Services was fraudulently claiming periodontal debt for treatment he had never received and attempting to exploit occupational health concerns to create believable billing scenarios. Christopher contacted Gum Disease Recovery Services to inform Clark that the fraudulent claims had been verified, but Clark continued to insist that the periodontal debt was legitimate and pressured him for payment. Christopher reported the periodontal billing fraud to his union's benefits department, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate periodontal billing involves proper treatment documentation, insurance processing, and coordination with referring dentists before pursuing collection activities against patients. Christopher learned that construction workers should verify all occupational health-related medical claims through their union benefits and should be suspicious of dental debt that cannot be documented through legitimate dental providers. The experience taught Christopher to recognize fraudulent dental billing and to help educate other construction workers about verifying dental debt through union benefits and legitimate dental practices. Christopher now educates other construction workers about dental billing fraud and emphasizes verifying all periodontal debt claims through union dental benefits and legitimate dental practices. Patricia, a 36-year-old nurse, received calls about dental implant bills that would test her understanding of restorative dentistry billing and teach her valuable lessons about fake dental implant scams. The caller claimed she owed money for dental implant surgery she had never undergone. Patricia had all her natural teeth and had never required dental implants or tooth replacement procedures. Her dental insurance through the hospital covered her routine dental care, and her dentist had never recommended implant treatment for missing or damaged teeth. Patricia had not undergone any implant surgery or restorative dental procedures that would account for substantial dental bills or collection efforts from oral surgery practices or dental billing companies. The caller, who identified herself as implant billing specialist Amanda Foster from Restorative Dental Collections, claimed that Patricia owed $5,700 for dental implant placement and crown restoration provided 9 months earlier at Elite Dental Implant Center. Ms. Thompson, you have an outstanding implant bill of $5,700 for titanium implant placement and porcelain crown restoration completed at Elite Dental Implant Center on February 10th. Foster said with apparent implant dentistry knowledge and restoration procedure expertise. Foster claimed that Patricia's dental insurance had denied coverage for the dental implant due to cosmetic classification and that the implant practice had referred her account to their collection agency after multiple billing attempts. Ms. Thompson, dental implants are often classified as cosmetic procedures by insurance companies, leaving patients responsible for the full cost of implant placement and restoration. Foster continued with apparent insurance classification knowledge and implant billing expertise. Foster explained that immediate payment was necessary to prevent the implant debt from being reported to credit bureaus and that the implant warranty would be voided if the account was not resolved within 1 week. Patricia was confused because she had all her natural teeth and had never undergone implant surgery or been referred to Elite Dental Implant Center for any procedures. I have all my natural teeth and have never had dental implant surgery, Patricia explained to Foster. Can you provide surgical records and documentation of the insurance cosmetic classification? Foster became evasive when Patricia requested implant documentation, claiming that surgical records and billing information contained proprietary information that required patient authorization and payment verification before release. Ms. Thompson, dental implant records contain detailed surgical information that requires patient authorization and payment verification before they can be discussed, Foster explained with apparent medical privacy knowledge and authorization procedures. Foster also claimed that the implant debt was approaching legal collection deadlines and that Patricia's dental health records would be affected if she didn't resolve the account immediately. Patricia felt suspicious about Foster's authorization claims and decided to use her healthcare knowledge to verify the implant billing independently through dental providers and insurance channels. Patricia contacted Elite Dental Implant Center to verify whether she had received any procedures and learned that she had no patient records or surgical appointments in their system. Patricia also contacted her regular dentist to confirm that all her natural teeth were healthy and that no implant referrals had been made for her care. Patricia contacted her dental insurance company to review her claims history and confirmed that no dental implant procedures had been submitted or processed for her coverage. Patricia realized that Restorative Dental Collections was fraudulently claiming implant debt for procedures she had never received and using legitimate dental implant terminology to create believable billing scenarios. Patricia contacted Restorative Dental Collections to inform Foster that the fraudulent claims had been verified, but Foster continued to insist that the implant debt was legitimate and threatened warranty voiding. Patricia reported the dental implant billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and Elite Dental Implant Center's administrative office. The authorities explained that legitimate dental implant billing involves extensive surgical documentation, insurance processing, and proper patient consent before pursuing collection activities. Patricia learned that healthcare professionals should use their medical knowledge to identify fraudulent dental billing and should help educate others about verifying implant debt through legitimate dental practices. The experience taught Patricia to apply her healthcare expertise to identify dental billing fraud and to help protect other healthcare workers from similar dental collection scams. Patricia now educates patients and healthcare colleagues about dental billing fraud and emphasizes verifying all dental implant debt claims through legitimate dental practices and insurance channels. Daniel, a 31-year-old electrician, received threatening calls about pediatric dental bills that would test his understanding of children's dental billing and teach him valuable lessons about fake family dental scams. The caller claimed he owed money for his young daughter's dental treatment that had never occurred. Daniel's 7-year-old daughter Emma received regular dental checkups and cleanings at their family dental practice, and she had never required any major dental treatments beyond routine preventive care. Their family dental insurance covered Emma's pediatric dental needs without billing complications. Daniel had not authorized any extensive pediatric dental treatment for Emma that would account for substantial dental bills or collection efforts from children's dental practices or billing companies. The caller, who identified himself as pediatric dental billing agent Paul Martinez from Children's Dental Recovery, claimed that Daniel owed $2,200 for Emma's cavity treatments and pediatric dental services provided at Rainbow Children's Dentistry. Mr. Garcia, you have an outstanding pediatric dental bill of $2,200 for your daughter Emma's cavity fillings and fluoride treatments completed at Rainbow Children's Dentistry during her recent visits, Martinez said with apparent pediatric dental knowledge and child treatment expertise. Martinez claimed that Daniel's family dental insurance had denied coverage for Emma's treatments due to plan limitations and that the pediatric dental practice had referred his account to their collection agency. Mr. Garcia, pediatric dental insurance often has coverage limitations for certain treatments, and when limits are exceeded, parents become responsible for additional dental costs. Martinez continued with apparent insurance limitation knowledge and pediatric billing expertise. Martinez explained that immediate payment was necessary to prevent the pediatric dental debt from affecting Daniel's credit score and that Emma's dental records would show continued treatment needs if the account wasn't resolved. Daniel was confused because Emma had healthy teeth and had never been treated at Rainbow Children's Dentistry or required cavity treatments beyond routine preventive care. My daughter has healthy teeth and has never been to Rainbow Children's Dentistry, Daniel explained to Martinez. Can you provide treatment records showing what dental work was supposedly done for Emma? Martinez became insistent when Daniel questioned the pediatric dental debt, claiming that children's dental problems often develop quickly and that parents sometimes don't realize the extent of treatment their children need. Mr. Garcia, children's dental problems can develop rapidly between checkups, and parents often don't realize when their children need extensive treatment, Martinez explained with apparent pediatric dental development knowledge and parental awareness issues. Martinez also claimed that electricians' work schedules often prevented them from attending their children's dental appointments, making it possible that Emma had received treatment without Daniel's direct involvement. Daniel felt angry about Martinez's assumptions regarding his parenting and decided to verify the pediatric dental billing through his family dentist and insurance company. Daniel contacted Rainbow Children's Dentistry to verify whether Emma had received any treatment and learned that she had no patient records or appointment history in their system. Daniel also contacted their family dentist to confirm that Emma's teeth were healthy and that no referrals had been made for pediatric dental treatment. Daniel contacted his family dental insurance to review Emma's claims history and confirmed that no pediatric dental treatments had been submitted or processed beyond routine preventive care. Daniel realized that Children's Dental Recovery was fraudulently claiming pediatric dental debt for treatment Emma had never received and attempting to exploit parental concerns about children's dental health. Daniel contacted Children's Dental Recovery to inform Martinez that the fraudulent claims had been verified, but Martinez continued to insist that the pediatric dental debt was legitimate and pressured him for payment. Daniel reported the pediatric dental billing fraud to his family dental insurance fraud department. the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate pediatric dental billing involves proper parental consent, treatment documentation, and insurance processing before pursuing collection activities against parents. Daniel learned that parents should verify all pediatric dental claims through their family dentists and insurance companies and should be suspicious of collection agencies claiming children's treatment that cannot be documented. The experience taught Daniel to protect his family from dental billing fraud and to help educate other parents about verifying children's dental debt through legitimate dental practices. Daniel now educates other electricians with families about dental billing fraud and emphasizes verifying all pediatric dental debt claims through family dentists and legitimate dental insurance channels. Nancy, a 33-year-old pharmacist, received calls about cosmetic dental bills that would test her understanding of aesthetic dentistry billing and teach her valuable lessons about fake cosmetic dental scams. The caller claimed she owed money for teeth whitening and cosmetic procedures she had never received. Nancy had naturally white teeth and had never required cosmetic dental treatments or aesthetic procedures. Her dental insurance covered her routine preventive care, and her dentist had never recommended whitening treatments or cosmetic dental work. Nancy had not received any cosmetic dental procedures that would account for aesthetic dental bills or collection efforts from cosmetic dental practices or billing companies. The caller, who identified herself as Cosmetic Dental Billing Coordinator Jennifer Hayes from Aesthetic Dental Collections, claimed that Nancy owed $1,800 for professional teeth whitening and cosmetic dental consultation provided at Brilliant Smile Cosmetic Dentistry. Ms. Mitchell, you have an outstanding cosmetic dental bill of $1,800 for professional whitening treatment and aesthetic consultation completed at Brilliant Smile Cosmetic Dentistry during your enhancement visits, Hayes said with apparent cosmetic dental knowledge and aesthetic procedure expertise. Hayes claimed that Nancy's dental insurance had denied coverage for the cosmetic treatments due to elective procedure classifications and that the cosmetic dental practice had referred her account to their collection agency. Ms. Mitchell, cosmetic dental procedures are typically classified as elective treatments by insurance companies, leaving patients responsible for the full cost of aesthetic dental services. Hayes continued with apparent insurance classification knowledge and cosmetic billing expertise. Hayes explained that immediate payment was necessary to prevent the cosmetic dental debt from being reported to credit bureaus and that Nancy's treatment results would deteriorate without follow-up care if the account wasn't resolved. Nancy was confused because she had never been interested in cosmetic dental treatments and had never visited Brilliant Smile Cosmetic Dentistry for any aesthetic procedures. I've never had cosmetic dental work or been to Brilliant Smile Cosmetic Dentistry, Nancy explained to Hayes. Can you provide treatment records showing what aesthetic procedures were supposedly performed? Hayes became evasive when Nancy requested cosmetic treatment documentation, claiming that aesthetic dental records contained proprietary treatment information that required patient authorization and payment verification before release. Ms. Mitchell, cosmetic dental records contain specialized treatment information that requires patient authorization and payment verification before they can be discussed, Hayes explained with apparent treatment privacy knowledge and authorization procedures. Hayes also claimed that the cosmetic dental debt was time-sensitive and that Nancy's aesthetic treatment warranty would expire if she didn't resolve the account within 72 hours. Nancy felt suspicious about Hayes's warranty claims and decided to use her pharmaceutical knowledge to verify the cosmetic dental billing independently through dental providers and insurance channels. Nancy contacted Brilliant Smile Cosmetic Dentistry to verify whether she had received any procedures and learned that she had no patient records or aesthetic appointments in their system. Nancy also contacted her regular dentist to confirm that her teeth were naturally white and that no cosmetic dental referrals had been made for her care. Nancy contacted her dental insurance company to review her claims history and confirmed that no cosmetic dental procedures had been submitted or processed for her coverage. Nancy realized that Aesthetic Dental Collections was fraudulently claiming cosmetic dental debt for procedures she had never received and using legitimate aesthetic dental terminology to create believable billing scenarios. Nancy contacted Aesthetic Dental Collections to inform Hayes that the fraudulent claims had been verified, but Hayes continued to insist that the cosmetic dental debt was legitimate and threatened warranty expiration. Nancy reported the cosmetic dental billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and her state's dental licensing board. The authorities explained that legitimate cosmetic dental billing involves proper patient consultation, treatment documentation, and clear payment agreements before pursuing collection activities. Nancy learned that healthcare professionals should use their medical knowledge to identify fraudulent dental billing and should help educate others about verifying cosmetic dental claims through legitimate practices. The experience taught Nancy to apply her pharmaceutical expertise to identify dental billing fraud and to help protect other healthcare workers from similar aesthetic dental collection scams. Nancy now educates patients and healthcare colleagues about dental billing fraud and emphasizes verifying all cosmetic dental debt claims through legitimate dental practices and insurance channels. Kevin, a 30-year-old mechanic, received phone calls about emergency dental bills that would test his understanding of urgent dental care billing and teach him valuable lessons about fake dental emergency scams. The caller claimed he owed money for after-hours dental treatment he had never received. Kevin had never experienced dental emergencies that would require after-hours or emergency dental treatment. His teeth were healthy, and he had never needed urgent dental care that would result in emergency dental bills or collection issues. Kevin had not received any emergency dental treatment that would account for urgent care bills or collection efforts from emergency dental practices or after-hours billing companies. The caller, who identified himself as emergency dental billing agent Robert Chin from Urgent Care Dental Collections, claimed that Kevin owed $1,600 for emergency dental treatment and pain management provided during a weekend emergency visit to 24-hour emergency dentistry. Mr. Brown, you have an outstanding emergency dental bill of $1,600 for urgent treatment and pain medication provided at 24-hour emergency dentistry during your weekend emergency visit, Chun said with apparent emergency dental knowledge and urgent care expertise. Chun claimed that Kevin's dental insurance had denied coverage for the emergency treatment due to out-of-network provider restrictions and that the emergency dental practice had referred his account to their collection agency. Mr. Brown, emergency dental treatment is often provided by out-of-network practitioners, leaving patients responsible for the full cost of urgent dental care. Chun continued with apparent insurance network knowledge and emergency billing expertise. Chun explained that immediate payment was necessary to prevent the emergency dental debt from affecting Kevin's credit score and that additional emergency dental records would be maintained if the account wasn't resolved quickly. Kevin was confused because he had never experienced dental emergencies and had never visited 24-hour emergency dentistry or any after-hours dental facilities. I've never had a dental emergency or been to 24-hour emergency dentistry, Kevin explained to Chun. Can you provide treatment records showing what emergency dental care was supposedly provided? Chun became aggressive when Kevin questioned the emergency dental debt, claiming that dental emergencies often occur during stressful periods when patients might not remember details of their urgent care treatment. Mr. Brown, dental emergencies often happen during stressful situations, and patients sometimes don't remember all the details of their emergency treatment. Chun insisted with apparent emergency situation knowledge and patient memory issues. Chun also claimed that mechanics were particularly susceptible to dental injuries due to work environment hazards, and that Kevin's occupation made emergency dental treatment more likely. Kevin felt frustrated by Chun's occupational assumptions and decided to verify the emergency dental billing through his dental insurance and regular dental provider. Kevin contacted 24-hour emergency dentistry to verify whether he had received any treatment and learned that they had no patient records or emergency visits for him in their system. Kevin also contacted his regular dentist to confirm that his teeth were healthy and that no emergency dental referrals or treatments had been documented. Kevin contacted his dental insurance company to review his claims history and confirmed that no emergency dental treatments had been submitted or processed for his coverage. Kevin realized that Urgent Care Dental Collections was fraudulently claiming emergency dental debt for treatment he had never received and attempting to exploit occupational hazard concerns to create believable billing scenarios. Kevin contacted Urgent Care Dental Collections to inform Chun that the fraudulent claims had been verified, but Chun continued to insist that the emergency dental debt was legitimate and threatened immediate collection action. Kevin reported the emergency dental billing fraud to his dental insurance fraud department, the Consumer Financial Protection Bureau, and his state's attorney general office. The authorities explained that legitimate emergency dental billing involves proper treatment documentation, insurance processing, and coordination with regular dental providers before pursuing collection activities. Kevin learned that mechanics should verify all occupational health-related medical claims through their insurance providers and should be suspicious of emergency dental debt that cannot be documented through legitimate providers. The experience taught Kevin to recognize fraudulent dental billing and to help educate other mechanics about verifying emergency dental debt through insurance companies and legitimate dental practices. Kevin now educates other mechanics about dental billing fraud and emphasizes verifying all emergency dental debt claims through dental insurance and legitimate emergency dental providers. Lisa, a 35-year-old social worker, received calls about denture billing that would test her understanding of prosthetic dentistry and teach her valuable lessons about fake denture collection scams. The caller claimed she owed money for dentures and prosthetic dental work she had never received. Lisa had all her natural teeth and had never required dentures or prosthetic dental appliances. Her dental insurance through social services covered her routine dental care, and her dentist had never recommended tooth extraction or denture treatment. Lisa had not received any prosthetic dental work or denture services that would account for substantial dental bills or collection efforts from prosthodontic practices or dental billing companies. The caller, who identified herself as prosthetic dental billing agent Susan Miller from Denture Recovery Services, claimed that Lisa owed $4,300 for complete upper and lower dentures and related prosthodontic services provided at Complete Smile Prosthetics. Ms. Roberts, you have an outstanding prosthetic dental bill of $4,300 for complete denture fabrication and fitting services completed at Complete Smile Prosthetics during your restoration treatment, Miller said with apparent prosthodontic knowledge and denture fabrication expertise. Miller claimed that Lisa's dental insurance had denied coverage for the denture work due to age restrictions and that the prosthetic dental practice had referred her account to their collection agency for immediate payment. Ms. Roberts, denture coverage often has age restrictions in dental insurance policies, leaving younger patients responsible for the full cost of prosthetic dental services. Miller continued with apparent insurance age restriction knowledge and prosthetic billing expertise. Miller explained that immediate payment was necessary to prevent the prosthetic dental debt from being reported to credit bureaus, and that Lisa's denture warranty and adjustment services would be terminated if the account wasn't resolved. Lisa was confused because she had all her natural teeth and had never undergone tooth extraction or received dentures from Complete Smile Prosthetics or any prosthetic dental practice. I have all my natural teeth and have never needed dentures, Lisa explained to Miller. Can you provide treatment records showing what prosthetic work was supposedly done? Miller became insistent when Lisa questioned the prosthetic dental debt, claiming that social workers often experienced high stress levels that could lead to dental problems requiring tooth extraction and denture placement. Ms. Roberts, social work is a high-stress profession that can lead to dental problems, and patients sometimes don't realize when their dental condition requires prosthetic treatment, Miller explained with apparent occupational health knowledge and dental stress impact. Miller also claimed that Lisa's work with disadvantaged populations might have exposed her to health risks that could affect her dental condition and make prosthetic treatment necessary. Lisa felt annoyed by Miller's professional assumptions and decided to verify the prosthetic dental billing through her social services benefits and regular dental provider. Lisa contacted Complete Smile Prosthetics to verify whether she had received any treatment and learned that she had no patient records or prosthetic appointments in their system. Lisa also contacted her regular dentist to confirm that all her natural teeth were healthy and that no extractions or prosthetic referrals had been made for her care. Lisa contacted her social services dental insurance to review her claims history and confirmed that no prosthetic dental procedures had been submitted or processed for her coverage. Lisa realized that Denture Recovery Services was fraudulently claiming prosthetic dental debt for services she had never received and attempting to exploit occupational stress concerns to create believable billing scenarios. Lisa contacted Denture Recovery Services to inform Miller that the fraudulent claims had been verified, But Miller continued to insist that the prosthetic dental debt was legitimate and threatened warranty termination. Lisa reported the prosthetic dental billing fraud to her Social Services Benefits Department, the Consumer Financial Protection Bureau, and her state's Attorney General office. The authorities explained that legitimate prosthetic dental billing involves extensive consultation, treatment planning, and insurance processing before pursuing collection activities against patients. Lisa learned that social workers should verify all occupational health-related medical claims through their benefits departments and should be suspicious of dental debt that cannot be documented through legitimate providers. The experience taught Lisa to recognize fraudulent dental billing and to help educate other social workers about verifying prosthetic dental debt through benefits departments and legitimate dental practices. Lisa now educates other social workers about dental billing fraud and emphasizes verifying all prosthetic dental debt claims through social services benefits and legitimate dental practices. Anthony, a 37-year-old firefighter, received threatening calls about dental trauma bills that would test his understanding of injury-related dental billing and teach him valuable lessons about fake trauma dental scams. The caller claimed he owed money for emergency dental repair after a workplace injury that had never occurred. Anthony maintained excellent dental health and had never been injured during firefighting duties in a way that would affect his teeth or require emergency dental treatment. His fire department insurance covered all work-related medical and dental care without billing complications. Anthony had not experienced any dental trauma or received emergency dental treatment that would account for injury-related dental bills or collection efforts from trauma dental practices or billing companies. The caller, who identified himself as Trauma Dental Billing Agent William Hayes from Injury Dental Recovery, claimed that Anthony owed $3,200 for emergency dental repair and trauma treatment provided after a workplace facial injury during a fire response. Mr. Davis, you have an outstanding trauma dental bill of $3,200 for emergency tooth repair and facial trauma treatment provided after your injury during the warehouse fire response on April 25th, Hayes said with apparent trauma dental knowledge and workplace injury expertise. Hayes claimed that Anthony's fire department insurance had denied coverage for the dental trauma treatment due to policy exclusions and that the trauma dental practice had referred his account to their collection agency. Mr. Davis, fire department insurance sometimes has exclusions for certain types of dental injuries, leaving firefighters personally responsible for trauma dental costs. Hayes continued with apparent insurance exclusion knowledge and trauma billing expertise. Hayes explained that immediate payment was necessary to prevent the trauma dental debt from affecting Anthony's credit score and that additional trauma dental records would be maintained if the account wasn't resolved quickly. Anthony was confused because he had never been injured during fire responses in a way that would affect his teeth and had never received emergency dental treatment for workplace trauma. I've never been injured on duty in a way that affected my teeth, Anthony explained to Hayes. Can you provide documentation showing the injury report and trauma dental treatment records? Hayes became aggressive when Anthony questioned the trauma dental debt, claiming that firefighters sometimes experience facial injuries during smoke-filled environments and might not immediately realize the extent of their dental damage. Mr. Davis, facial trauma during firefighting can cause dental damage that isn't immediately apparent, and firefighters sometimes don't realize they've been injured until later. Hayes insisted with apparent firefighting injury knowledge and delayed trauma recognition. Hayes also threatened to contact Anthony's fire department supervisor about the unpaid trauma dental debt, claiming that unresolved injury-related bills could affect his employment status and benefits eligibility. Anthony felt angry about Hayes' aggressive tactics and decided to verify the trauma dental billing through his fire department and insurance providers. Anthony contacted his fire department's injury reporting office to verify whether he had any workplace injury claims involving dental trauma and learned that he had no injury reports in their system. Anthony also contacted the trauma dental practice Hayes claimed had provided treatment and learned that they had no patient records or emergency visits for him. Anthony verified with his fire department insurance that no trauma dental claims had been submitted or processed for his coverage. Anthony realized that Injury Dental Recovery was fraudulently claiming trauma dental debt for treatment he had never received and attempting to exploit firefighter injury concerns to create believable billing scenarios. Anthony contacted Injury Dental Recovery to inform Hayes that the fraudulent claims had been verified, but Hayes continued to insist that the trauma dental debt was legitimate and threatened immediate collection action. Anthony reported the trauma dental billing fraud to his fire department's Fraud Investigation Unit, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate trauma dental billing involves proper injury documentation, insurance processing, and coordination with workplace injury reporting before pursuing collection activities. Anthony learned that firefighters should verify all workplace injury-related medical claims through official department channels and should be suspicious of trauma dental debt that cannot be documented through legitimate providers. The experience taught Anthony to use his professional knowledge to identify fraudulent dental billing and to help educate other firefighters about verifying trauma dental debt through official channels. Anthony now educates other firefighters about dental billing fraud and emphasizes verifying all trauma dental debt claims through fire department channels and legitimate emergency dental providers. Michelle, a 32-year-old bank manager, received calls about dental laboratory bills that would test her understanding of dental lab services and teach her valuable lessons about fake dental lab collection scams. The caller claimed she owed money for dental crowns and laboratory work she had never ordered. Michelle had healthy natural teeth and had never required crowns, bridges, or other dental laboratory work. Her bank's dental insurance covered her routine preventive care, and her dentist had never recommended any restorative work requiring dental laboratory services. Michelle had not received any dental restorative work that would account for dental laboratory bills or collection efforts from dental labs or billing companies specializing in laboratory services. The caller, who identified herself as dental lab billing specialist Karen Thompson from Laboratory Services Collections, claimed that Michelle owed $2,600 for crown fabrication and laboratory services provided for her restorative dental treatment at Precision Dental Laboratory. Ms. Wilson, you have an outstanding dental laboratory bill of $2,600 for porcelain crown fabrication and related lab services completed for your restorative treatment at Precision Dental Laboratory, Thompson said with apparent dental lab knowledge and crown fabrication expertise. Thompson claimed that Michelle's dental insurance had denied coverage for the laboratory work due to material restrictions and that the dental laboratory had referred her account to their collection agency for immediate payment. Ms. Wilson, dental insurance often restricts coverage for premium laboratory materials, leaving patients responsible for the full cost of high-quality dental lab work. Thompson continued with apparent insurance restriction knowledge and lab billing expertise. Thompson explained that immediate payment was necessary to prevent the laboratory debt from being reported to credit bureaus and that the dental laboratory warranty would be voided if the account wasn't resolved within 48 hours. Michelle was confused because she had never needed crowns or other dental work requiring laboratory services and had never been referred to Precision Dental Laboratory for any restorative treatment. I've never needed crowns or dental lab work, Michelle explained to Thompson. Can you provide documentation showing what laboratory services were supposedly provided for my treatment? Thompson became evasive when Michelle requested laboratory documentation, claiming that dental lab records contained technical information that required authorization from both the patient and the referring dentist before release. Ms. Wilson, dental laboratory records contain technical specifications that require authorization from both you and your dentist before they can be discussed, Thompson explained with apparent lab privacy knowledge and authorization procedures. Thompson also claimed that the dental laboratory debt was time-sensitive and that Michelle's crown warranty would expire if she didn't resolve the account immediately. Michelle felt suspicious about Thompson's warranty claims and decided to verify the dental laboratory billing through her regular dentist and insurance company. Michelle contacted Precision Dental Laboratory to verify whether any work had been done for her and learned that they had no records or laboratory orders for her in their system. Michelle also contacted her regular dentist to confirm that no restorative work had been planned or completed that would require dental laboratory services. Michelle contacted her bank's dental insurance to review her claims history and confirmed that no dental laboratory services had been submitted or processed for her coverage. Michelle realized that Laboratory Services Collections was fraudulently claiming dental lab debt for services she had never received and using legitimate laboratory terminology to create believable billing scenarios. Michelle contacted Laboratory Services Collections to inform Thompson that the fraudulent claims had been verified, but Thompson continued to insist that the laboratory debt was legitimate and threatened warranty voiding. Michelle reported the dental laboratory billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and her bank's Employee Benefits Fraud Department. The authorities explained that legitimate dental laboratory billing involves proper dentist orders, treatment documentation, and insurance processing before pursuing collection activities against patients. Michelle learned that bank employees should verify all medical and dental claims through their employee benefits departments and should be suspicious of laboratory debt that cannot be documented through legitimate dental providers. The experience taught Michelle to recognize fraudulent dental billing and to help educate other bank employees about verifying dental debt through employee benefits and legitimate dental practices. Michelle now educates other bank employees about dental billing fraud and emphasizes verifying all dental laboratory debt claims through employee benefits and legitimate dental practices. Stephen, a 39-year-old postal worker, received phone calls about dental anesthesia bills that would test his understanding of dental sedation billing and teach him valuable lessons about fake anesthesia collection scams. The caller claimed he owed money for sedation services during dental procedures he had never undergone. Stephen had never required dental sedation or anesthesia for any dental procedures. His routine dental cleanings and checkups were performed without sedation, and he had never undergone any dental work that would require anesthesia services or specialized billing. Stephen had not received any dental procedures requiring anesthesia that would account for sedation bills or collection efforts from anesthesia providers or dental billing companies specializing in sedation services. The caller, who identified himself as dental anesthesia billing agent Paul Martinez from Sedation Services Recovery, claimed that Stephen owed $1,400 for anesthesia services and sedation monitoring provided during extensive dental procedures at Comfort Dental Sedation Center. Mr. Adams, you have an outstanding dental anesthesia bill of $1,400 for sedation services and monitoring provided during your extensive dental treatment at Comfort Dental Sedation Center, Martinez said with apparent dental anesthesia knowledge and sedation procedure expertise. Martinez claimed that Stephen's dental insurance had denied coverage for the anesthesia services due to medical necessity requirements, and that the sedation practice had referred his account to their collection agency. Mr. Adams, dental anesthesia requires medical necessity documentation for insurance coverage, and when necessity isn't established, patients become responsible for sedation service costs. Martinez continued with apparent insurance necessity knowledge and anesthesia billing expertise. Martinez explained that immediate payment was necessary to prevent the anesthesia debt from affecting Stephen's credit score and that sedation service records would be maintained if the account wasn't resolved quickly. Stephen was confused because he had never received dental treatment requiring anesthesia and had never been to Comfort Dental Sedation Center for any procedures involving sedation services. I've never needed dental anesthesia or been to Comfort Dental Sedation Center, Stephen explained to Martinez. Can you provide records showing what procedures supposedly required anesthesia services? Martinez became insistent when Stephen questioned the anesthesia debt, claiming that postal workers often required dental sedation due to work stress and anxiety about dental treatment. Mr. Adams, postal workers often experience high stress levels that make dental anxiety worse, requiring sedation services for routine dental procedures, Martinez explained with apparent occupational stress knowledge and dental anxiety correlation. Martinez also claimed that Stephen's work schedule might have made him forget about dental appointments that required anesthesia services due to the busy nature of postal delivery routes. Stephen felt frustrated by Martinez's occupational assumptions and decided to verify the anesthesia billing through his postal service benefits and regular dental provider. Stephen contacted Comfort Dental Sedation Center to verify whether he had received any services and learned that they had no patient records or sedation appointments for him in their system. Stephen also contacted his regular dentist to confirm that all his dental care had been performed without sedation and that no anesthesia referrals had been made. Stephen contacted his Postal Service dental insurance to review his claims history and confirm that no dental anesthesia services had been submitted or processed for his coverage. Stephen realized that Sedation Services Recovery was fraudulently claiming anesthesia debt for services he had never received and attempting to exploit occupational stress concerns to create believable billing scenarios. Stephen contacted Sedation Services Recovery to inform Martinez that the fraudulent claims had been verified, but Martinez continued to insist that the anesthesia debt was legitimate and threatened immediate collection action. Stephen reported the dental anesthesia billing fraud to his Postal Service Benefits Department, the Consumer Financial Protection Bureau, and his state's Attorney General office. The authorities explained that legitimate dental anesthesia billing involves proper procedure documentation, medical necessity verification, and insurance processing before pursuing collection activities. Stephen learned that postal workers should verify all occupational health-related medical claims through their benefits departments and should be suspicious of anesthesia debt that cannot be documented through legitimate providers. The experience taught Stephen to recognize fraudulent dental billing and to help educate other postal workers about verifying anesthesia debt through benefits departments and legitimate dental practices. Stephen now educates other postal workers about dental billing fraud and emphasizes verifying all dental anesthesia debt claims through Postal Service benefits and legitimate dental practices. Rebecca, a 40-year-old veterinarian, received calls about dental consultation bills that would test her understanding of specialist dental billing and teach her valuable lessons about fake dental specialist scams. The caller claimed she owed money for endodontic consultation she had never received. Rebecca maintained excellent dental health through regular preventive care and had never required specialist dental consultation or endodontic treatment. Her veterinary practice dental insurance covered her routine care, and her general dentist had never referred her to dental specialists. Rebecca had not received any specialist dental consultation that would account for endodontic bills or collection efforts from dental specialists or billing companies specializing in specialist services. The caller, who identified herself as endodontic billing coordinator Lisa Morgan from Specialist Dental Collections, claimed that Rebecca owed $800 for endodontic consultation and diagnostic services provided at Advanced Endodontic Associates. Dr. Garcia, you have an outstanding endodontic consultation bill of $800 for specialist evaluation and diagnostic services provided at Advanced Endodontic Associates for your complex dental case, Morgan said with apparent endodontic knowledge and specialist consultation expertise. Morgan claimed that Rebecca's dental insurance had denied coverage for the endodontic consultation due to referral documentation issues and that the specialist practice had referred her account to their collection agency. Dr. Garcia, endodontic specialist consultations require proper referral documentation for insurance coverage, and when documentation is incomplete, patients become responsible for consultation costs. Morgan continued with apparent referral requirement knowledge and specialist billing expertise. Morgan explained that immediate payment was necessary to prevent the consultation debt from being reported to credit bureaus and that follow-up specialist appointments would be canceled if the account wasn't resolved. Rebecca was confused because she had never been referred to Advanced Endodontic Associates or required endodontic consultation for any dental problems. I've never needed endodontic treatment or been referred to Advanced Endodontic Associates, Rebecca explained to Morgan. Can you provide documentation showing the referral and consultation records? Morgan became evasive when Rebecca requested consultation documentation, claiming that endodontic specialist records contained complex diagnostic information that required authorization from both the patient and referring dentist. Dr. Garcia, endodontic consultation records contain detailed diagnostic information that requires authorization from both you and your referring dentist before they can be released, Morgan explained with apparent specialist privacy knowledge and authorization procedures. Morgan also claimed that the consultation debt was approaching collection deadlines and that Rebecca's professional reputation could be affected by unresolved medical debt as a healthcare provider. Rebecca felt suspicious about Morgan's professional reputation claims and decided to use her veterinary medical knowledge to verify the endodontic billing independently. Rebecca contacted Advanced Endodontic Associates to verify whether she had received any consultation and learned that she had no patient records or appointments in their system. Rebecca also contacted her regular dentist to confirm that no endodontic referrals had been made and that her teeth were healthy without requiring specialist consultation. Rebecca contacted her veterinary practice dental insurance to review her claims history and confirm that no endodontic consultation services had been submitted or processed for her coverage. Rebecca realized that Specialist Dental Collections was fraudulently claiming endodontic consultation debt for services she had never received and attempting to exploit healthcare professional concerns about reputation. Rebecca contacted Specialist Dental Collections to inform Morgan that the fraudulent claims had been verified, but Morgan continued to insist that the consultation debt was legitimate and threatened professional reputation damage. Rebecca reported the endodontic consultation billing fraud to the Consumer Financial Protection Bureau, her state's Attorney General office, and her state's dental licensing board. The authorities explained that legitimate specialist dental billing involves proper referral documentation, consultation records, and insurance processing before pursuing collection activities against patients. Rebecca learned that healthcare professionals should use their medical knowledge to identify fraudulent medical billing and should help educate others about verifying specialist debt through legitimate healthcare channels. The experience taught Rebecca to apply her veterinary medical expertise to identify dental billing fraud and to help protect other healthcare professionals from similar specialist collection scams. Rebecca now educates veterinary colleagues about dental billing fraud and emphasizes verifying all specialist dental debt claims through legitimate dental practices and insurance channels.